How's it going, everyone? Dr. Dan over here with some barefoot tips. Barefoot training is probably one of the best changes that I made over my life in the past 5 or 6 years that has improved the health of my feet, my ankles, my knees, my hips, and my spine, right? So one of the best decisions I've ever made was to ditch my junk footwear. Junk footwear is footwear that is thick and that doesn't bend, right? So if you take your shoe off right now, does your footwear bend? Can your feet, which have muscles and bones and joints within them, can your feet move in your footwear? Or is your shoe so stiff that it doesn't bend at all? Most athletic shoes that people are recommended in shoe stores are very stiff and thick-soled, which does a number of different things, but one major thing, it makes our brain and our nervous system weaker. And barefoot training helps to make our brain and our nervous system stronger. Barefoot training has a whole host of benefits, improved foot control, improved nerve health, improved circulation in the lower extremity, reduced joint pain throughout the body, improved spine health, improved posture. There's a whole number of benefits from grounding or barefoot training, okay? So one of my favorite shoe companies is Vivo Barefoot. They are an awesome barefoot training shoe company that makes shoes for wintertime, fall time, athletic time, dress, all different things. This is one of their athletic models, and I'm going to talk a little bit about it and a little bit about what we use inside of it, right? So anytime I get a pair of shoes, the first thing I do is rip out the insole. Actually, the first thing I do is make sure that it bends well. And all Vivo Barefoot shoes have this really awesome puncture-resistant sole that is great for developing stronger feet muscles, and ultimately, once you get strong feet muscles, you will never, ever have plantar fasciitis, Achilles tendonitis, knee problems, hip problems, right? So first thing I do, I rip out the insole and I switch it over to Naboso textured insole, right? Naboso textured insole, basically what it is, it's kind of like, I like to use the analogy, it's like Braille for your feet, right? Most people get orthotics, hard, smooth, or even gel cushioned orthotics that cushion the body and decrease the body's ability to absorb vibration. You see in all of our videos how imperative, how necessary vibration is to help heal the body. The Naboso insoles help to stimulate the small nerves and muscles in the bottom of the foot, which ultimately increase the circulation and help to fire up the longest track of nerve in your body, your brain to foot, okay? So, one, insoles. Slip right in. Again, these are not orthotics. They are textured insoles with a couple purposes, but the major one is to just stimulate the nerves and improve circulation in the bottom of the feet. The second thing you see me standing on here is this Naboso standing mat. This is what I and my wife have in our bathroom at home. Anytime I'm brushing my teeth, I'm doing a number of different foot exercises, kind of like running my foot along the bottom of the surface, which helps to, again, stimulate the nerves, the muscles, and even the arteries, the veins, the capillaries to improve circulation into the bottom of the foot. Now, this is the standing mat. They've got insoles. They also have yoga mats, which are really awesome for any yogis out there or barefoot training enthusiasts that want to develop better lower extremity and upper extremity muscle control, posture, and ultimately reducing your risk of injury, okay? So a couple tips in this video. One, if you're not sure about what shoes to go with, if you're a patient in the clinic or a client at the gym, we can help guide you down that path. You cannot transition immediately into barefoot shoes if you're used to big, thick shoes. There is a different acclimation period for everybody. So tip number one, learn how to transition into barefoot shoes. We can go through other videos with that. Two, textured insoles and textured mats are really great to help you with any number of foot problems, plantar fasciitis, bunions, hammer toes, Achilles tendonitis, flat or fallen arches, toes that are crooked and that just don't line up appropriately. When you're a patient of mine in our clinic, we teach you how to stretch your toes out without the use of drugs or surgery. Many doctors out there will pin and screw together your toes to keep them straight. They're not addressing, in most cases, the root cause, which is improper leg and hip and core muscle function. It's a deep conversation, but if you want to have it, you can reach out to us on Instagram or check us out on YouTube. We have a number of barefoot training videos where you can learn more about how to self-care and improve the health of your foot. My name is Dr. Dan. We're going to show you how to use these products in future videos.